And welcome back to Life Unrehearsed. My name is Matt Del Vecchio, specializing in life transitions, home care, and the senior living industry.
And my name is Corrie. I'm a clinical social worker and the author of Someone Died, Now What?
Corrie, you are a professor at McGill. You've been a long-time professor. You've been doing some online teaching, but I think you, like many others, you're going back in class, aren't you, soon?
That's right. It's been nice to not have to schlep in downtown in the freezing cold, but it's also been much more about safety. And so we'll see. The plan is to go back to teaching. I believe on the 24th, we're going into person teaching, but who knows? Stay tuned, Matt, because I heard there's some of the social work students are going to be voting. So,
oh, really?
Your guess is as good as mine.
The vote is out on it. It's almost 50-50 for those for in class and those for still wanting to do it virtually. But hard one.
One doesn't know. Anyways, moving along, let's talk about today's segment on helping moms and dads. We've been providing guidance and support to the sandwich generation, and it's really been wonderful because we've had a lot of very interesting and knowledgeable guests that have covered tons of topics, and this week is no exception. Matt, what are we covering?
Yeah, the pandemic, it's resulted in an increasing demand for mobile healthcare services. And we wanted to dig a little deeper on this subject. So by discussing a couple of the more popular mobile services, and we're going to begin with Anthony Izzo. Anthony has been a medical laboratory technologist for 30 years. And for the last 20 years, he's been the owner and director of operations for Santé Mobile A1. Anthony, welcome to Life Unrehearsed.
Thank you so much, Matt. Thank you, Corrie. Thank you for having me today.
Well, thanks for coming on the show. You offer such an incredible service. And why don't we start off with giving us a brief summary of what you do?
Okay, so I'm a medical laboratory technologist by profession. I used to work at St. Mary's for about 20 years, and the last 10 years I've been working full-time in doing mobile services in my own business. Prior to that, I did another 10 years part-time in my business, so for a total of 20 years. But in my profession as a medical technologist and in Santé Mobile A1, we basically provide mobile blood taking services and laboratory services, not just for blood, but also for urine, stool, and we collect samples, even samples for COVID swabs, for the famous COVID swabbing PCR.
Mm-hmm. Mm-hmm. So I guess that leads into my question, because I suspect I know the answer, but very curious. Has a demand for increasing services has the services during the pandemic increased? And if so, why?
That's a great question, Corrie. Well, after 20 years, I would have to say that the last 2 years have been my busiest 2 years of my career. It's actually, I'm in this industry now for 30 years, and this is definitely the busiest 2 years of my career. So people are having trouble getting appointments. People are trying to click on Santé to get appointments, and they're finding out that they're only getting appointments in 2-3 months from now. So more and more people are looking for the convenience of somebody coming to their home. So yes, the increase has definitely gone up. Nobody wants to wait in line. Nobody wants to drive around in traffic. The bad weather sometimes doesn't help. We have more and more seniors that are not driving anymore. Once they reach a certain age, they either lose their driver's license or they can't drive anymore. All kinds of reasons or excuses are out there. But when it comes to hearing about a mobile service that comes to you, especially during these pandemic times, the increase has definitely gone up.
You could see that. They're talking with Anthony Izzo. He's the owner of Santé Mobile A1, and we're talking about the ever-increasing demand for mobile healthcare services. It happened to me, Anthony. I had to get a blood test. I went on and clicked Santé, or the website, and it was like 3 months later was the first availability. And throw that in with everyone worried about going to a hospital these days and trying to get a blood test. So good on you, and it makes perfect sense that this has been the busiest it's been for the last 2 years. I think people are concerned about costs of getting these services, but I think many of your costs are covered by insurance, aren't they?
Exactly. So we have about 80% of our clients that have private insurance. So they have under the category of diagnostic blood tests. they can easily call us up, and then they find out that they have like 80% coverage. We even have clients who call us back and say they even have 100% coverage. So if they're affiliated with an insurance provider that provides diagnostic blood tests, they can call us up. Our house call may not be covered, but the diagnostic tests are usually covered, and that obviously represents the bulk of the services. We do the blood taking service for those tests, and ultimately we deliver it to the affiliated labs, and then the results come back. And then, of course, they submit their receipt to their insurance company, and then they get remunerated back from their insurance company.
I think this is a great service. I think it sounds so convenient. And, people that are worried about going somewhere or going out and being in contact with other people, well, that eliminates that. On the other hand, how do you deal with health and safety concerns about a stranger coming into someone feeling a little overwhelmed about a stranger coming into their house, especially during a pandemic?
Well, we have those questions every day. Like many people call us and ask us, they ask us a little bit about our background, who will be coming by, does he have any experience, does he apply any safety measures? Of course, especially during the pandemic, we tell our clients we have to wear our gloves, we wear our masks, we wear our N95, we wear our shield. If we're doing the PPE, if we're doing the COVID testing, we're definitely going to have to wear the gown as well. But this secures our clients, their safety. They're protected from us, and we're protected from them, of course. So, but I remember 20 years ago when I first started, this question was brought up within the family. Myself and my wife, we discussed what if somebody is a little bit afraid of who the person is coming in. But, these days, mobile services, you have the electrician coming in, the plumber coming in, you have somebody coming in to replace your tires now, a mobile tire service, so it becomes just another service that they can add to their famous list of mobile services, and more people are becoming comfortable. But I do have to admit, a lot of my clients that call me, it's all through references. They know who I am. They've used me before. They refer their other friends and family members. Once they know who they are, once they know who my nurse is, they feel more comfortable. So the safety measures, it's totally the most important aspect right now of going through this pandemic. I hear many people trying to do what I'm doing, and they fall into the category of getting COVID. So it means that they didn't tie up their hair. Maybe they didn't wear a shield, and we've seen this all the time. We've seen nurses or other health professionals. Not to pick on any nurse, but we've seen other health professionals who've gone to do what we've done, and the consequences are not so good. And then we find out that they either not wearing a gown, or they're wearing the same gown over and over again, which is totally inappropriate. So we have to apply those safety measures. Everything is used once, and before we leave, everything gets discarded.
Listening to Life Unrehearsed with Matt and Corrie, and we're talking about mobile healthcare services with the owner of Santé Mobile A1, Anthony Izzo. We have to head out to traffic very, very soon, Anthony. Real quick, I know you get this question a lot. How do you deal with the fear of needles in 30 seconds or less?
Yeah, it's a great question, Matt. So we have people who have phobias, and we have newborns, babies. We use basically a butterfly needle. It's a baby needle, and it's like 3 times smaller than the average needle. And you know what? We have many adults calling us up. They're already explaining to us that they have difficult veins, and we tell them, look, this butterfly needle exists for a reason. It's to make our job easier. And we love this product, and it's the best thing that's come out in the last 30 years. It's been around for a while, but many people still don't know about it. And I recommend if you have a phobia or scared of needles or have small veins, we do have the proper tools to make it easier for everybody.
That's just great. All right, Anthony, how can people get a hold of you?
Hey, they can call us on our web. They can look us up on our website, www.santemobile.com, SANTEMOBILE.com. And I have a little tagline. I always tell people, Santé Mobile A1, so you don't have to.
All right, that's Anthony Izzo, the owner of Santé Mobile A1. Thank you so much, Anthony.
Thank you so much, Matt. Thank you, Corrie.
All right, we're going to continue our discussion about the growing trends of mobile healthcare services. We'll be talking about in-home private fitness services for autonomous, semi-autonomous, and frail older adults.